RSV is one of those dreaded terms, a respiratory virus that can be severe or even deadly, and the youngest patients are among the most vulnerable. The CDC says RSV puts as many as 80,000 children under the age of 5 in the hospital each year in the U.S., but there's now a way to get out in front of it. Dr. Andrew Gelfand is here. He's a pediatric pulmonologist at Children's Health and associate professor at UT Southwestern. Good morning, doctor. Thank you so much for waking up early and joining us here on Daybreak.
Good morning. Thanks for having me.
Of course. Okay, so let's start with what exactly is RSV?
So RSV is the most common respiratory viral infection that occurs, and it tends to have the most effect in the youngest of infants or the youngest of children. So typically the most vulnerable to this are children who are 1 year or less or even 2 years or less. But the ones with the smallest airways tend to have the most difficulty handling the virus.
So what kind of symptoms should we be looking out for? What are the symptoms of RSV?
So for most people, it's just almost like a common cold. So you'll get a lot of runny nose, you can get fever, you can get congestion. And when the nose is very congested, babies can have trouble drinking. But when it affects the lower airways, then we start seeing more coughing, more wheezing, something called retractions, where your ribs go in and out, and that's a true sign that you're having difficulty breathing. And in some babies, especially the really young ones, when they have this respiratory distress, they can actually start having apnea, or they stop breathing, and that's when it gets very dangerous as well.
Scary as well.
Scary.
Now, why was this so severe last year?
Last year was a very unusual year in the fact that, one, it came at a different time than it normally does. It's normally a very predictable season from like October, November through March and April, but it came in the summer. And I think that was because the effect of COVID had on the virus kind of moved the seasons a little bit, but we're hoping it's back on its normal path this year. The second reason I think it was so bad is it was the first time that the masks came down.
You're right.
So the kids who were in their first year of life who didn't get it, because everybody gets RSV between their first and second year of life, they didn't get it their first year. So now we had two sets of children who are getting exposed to RSV for the very first time, and that made the season more impactful.
Now, I think this is going to be news to many people. The FDA recently approved a new drug to prevent the virus.
They did. They approved a drug. It's called nirsevimab, or you'll know it as Beyfortus. And this is a monoclonal antibody, so it's not a true vaccine, but it's an antibody. An antibody mimics your body's natural response to the virus. So if you have this antibody in your system, when the RSV comes, it'll bind to the virus and will not allow the virus to infect your cells and create that inflammatory reaction. So it's very protective, and it's been shown in studies to prevent 70% of hospitalizations from RSV and 90% decrease in ICU admissions secondary to RSV.
That's a
so
big
very
deal.
Powerful.
I guess what ages is this recommended for?
It's going to be recommended for kids who are 8 months of age or less, going into the RSV season, which typically is November through March, April. And then for certain kids who are even more vulnerable to the virus, they can sometimes be approved for a second year. So kids with bronchopulmonary dysplasia because they were born early, or congenital heart disease, or significant neuromuscular weakness, or just any kind of chronic lung disease will probably be eligible for a second year.
Wow. And I guess as a new mom myself to a 5-month-old, any ways, I guess, to prevent RSV, or what should I be doing now at the peak season?
The best way to prevent RSV is very good hand washing, if you see people if you have small babies who are very vulnerable, avoidance is the best way. Try not to send them out in busy times in restaurants and where people are sick. But if you have to, for example, daycare people have to, then you do what you can to try to prevent in other ways, and maybe try this vaccine, or it's not a vaccine, but try this treatment to try to prevent your child from getting a severe illness with it.
Dr. Andrew Gelfand, thank you so much for joining us here on Daybreak. A pleasure to have you. Great information as well, very insightful. For more information as well, please go to childrens.com.